Hi guys, my name is Crystal Broussard. I am the family doctor and weight loss doctor at Genesis Medical Group in Harmony Aesthetics in Spring, Texas. This video is just to give you like a really quick down and dirty informative video about what the new weight loss injections are, what they're made of, and a little bit of details. I'm literally answering this question 30 to 40 times a day, and so I want to give you some information so you can make informed decisions. Pardon the way I look, I'm exhausted. It's nighttime. I've worked for 14 hours, but I want to get this out for you guys. So first thing is, what are these medications? So the newest weight loss drugs are a medication called GLP-1 agonist, and that is a peptide that is part of our digestive tract. So a lot of questions I get are about the safety concerns about the medication because it's brand new. So the key is this group of medications is not new. It was invented for diabetes, and the very first one of these medications came out in 2009. So the medication itself, the class, has existed for 14 years, so it's not new. There is a once a day injection called Victoza that was remarketed by that company as Saxenda, and that was in 2014. So we've had this medication as Saxenda, which is a weight loss drug, for 9 years. Now, the key with Saxenda, what made it not so successful? One, it's a once a day injection. Two, no insurances would cover it at all, so nobody could afford it. And number three is that it gave a 5% body weight loss reduction over the course of a year, which actually our goal in the medical community is 5 to 10% body weight loss, because that is actually what changes your risk of heart attack and stroke and diabetes and the risk of about 20 different types of cancer. So it actually matters, but for most patients, it's not going to be enough weight loss for them to feel like it's worth it. Then came along diabetic medications that now became once a week injections. So these are medicines like Ozempic and Trulicity and Bydureon. So these are good medicines because they're just once a week. So Novo Nordisk actually had the medication Ozempic, and they did studies and remarketed the medicine as Wegovy. So why is Wegovy important? Because at this moment, it is the most effective weight loss drug we've ever had FDA approved. And I say at this moment and FDA approved because I'll get into a little bit more later. But right now, it's the most effective thing that we have. And we see about a 15 to 17% body weight loss with this medication over the course of a year. So that's actually really good. That changes your health, how you feel. It changes your metabolism. It changes everything. The new medication, the newest medication for diabetes, is actually called Mounjaro, which is one of these same medicines, a GLP-1 agonist, but it's also combined with something called a GIP, which is another peptide. And those two peptides together, they regulate 70% of our insulin response. That is why the Mounjaro, the combination, is more effective than just the one ingredient. Now, Eli Lilly, which is the company that makes Mounjaro, they are actually fast tracking. The FDA allowed them to fast track into the latter parts of their studies for this to actually be a weight loss drug. Now, why does that matter? Because we're seeing a 22-ish%, 25-ish% body weight loss. And even more importantly, more than a third of the patients that were studied for Mounjaro actually lost more than the 25%. So we always give like the average, but we saw some really good weight loss on the Mounjaro trials. Now the exciting thing is that as we are learning about combining these peptides, because we only had them separate, as we're learning to combine these, we're getting even better weight loss. And so we have drugs coming down the pipe that look at 30%, 35% body weight loss. So we are literally talking about medications that are as effective as bariatric surgery. And so it's super exciting because we've never had anything like this. We've only had Band-Aids. I've been doing weight loss medicine since 2007. And this is the first time we actually have medications to actually treat the problem instead of just a Band-Aid to put on for like the appetite. So, okay, let's talk about how the medicines work. So it's twofold. So one thing is that it slows gastric emptying. So what that does is it makes you feel fuller faster. You're less hungry, you eat less. It's just a calorie restriction. But the other thing it does, which I think is super important and maybe even more important in the difference, is that it treats insulin resistance. And insulin resistance, in my opinion, is what I think is the problem in the US. It is the carbs that we eat, the type of carbs we eat, is our lack of exercise, and it's our processed food. And all that together, it gives us one of the highest incidence of insulin resistance. It's also the reason that we have the highest incidence of diabetes and prediabetes, and the horrific statistics that are coming as far as how many people are going to have diabetes in our country. It's terrifying. So I actually think that the difference is it's after the metabolic problem that is the weight issue in the US. Now, let's talk about contraindications. So contraindications, there's a few reasons that this medicine is not a good idea for you. Number one, if there's a family history of medullary thyroid cancer. So it's not just all thyroid cancers, it's a very specific type of cancer, medullary thyroid cancer. And the second thing is if you've had pancreatitis. And the third thing is that if you have stage 4 kidney disease. So that is like you're getting really close to dialysis. If that is the case, then we need the approval of your nephrologist before we start this medicine. Okay, let's talk about side effects. So side effects, all based on the fact that it slows gastric emptying. So they're GI side effects. So all the things you could have: nausea, vomiting, diarrhea, constipation, abdominal pain, bloating. Most people don't get all that. My job is to tell you all the worst case. Most people, if they get a little bit of side effects, it's usually a little bit of nausea or a little bit of heartburn. It's usually very short lasting, maybe 1 to 2 days. As you take these medications week by week, it gets less and less. However, every time we step up the dose of the medicine, you might get the side effects again. So what we've learned from the Wegovy studies is that we treat these medications different if we want weight loss versus just diabetes treatment. So if I have a diabetic and I've given one of these once a week shots for them, all I care about is getting their sugar controlled. That's it. I want to get them to the dose, the lowest possible dose, to control the sugar, and then we're done. What we've seen with weight loss is the opposite. The highest doses give the better weight loss. So what we do in that regard is that we titrate up every month until we get to the highest dose, as long as you tolerate it, because that is the best dosing for weight loss. And so every time we go up each month, you could have some side effects with it. Okay, all that being said, one of the really important things I talk to all my patients about before we start the medicine is about the fact that these are most likely long-term medications. So I just talked about insulin resistance. If you have a weight issue, if you're overweight, if you have a history of obesity, if you've been 110 pounds heavier like I am, that never goes away. So the insulin resistance never goes away. Our tendency to gain weight never goes away. The fact that our metabolism has been downshifted to try to make us gain weight never goes away. Sadly, you can stay at your maintenance weight for 20 years and your metabolism still stays at a point where it wants to make you gain weight. It's really sad. But it's one of the reasons that we think we have to treat the weight loss medications the exact same way as we treat any other metabolic problem. So if you have high blood pressure, most people have to stay on their medicine for life. Now, what we're finding as we are moving patients more and more towards maintenance and into maintenance is that I think everybody's maintenance is going to look different. So for almost all my patients that we have these medications for weight loss, we're able to reduce them down to the lowest dose. And then that's where it gets a little bit different. So I have some patients that have to stay on the medicine weekly. And then I have some patients that we've been able to stretch them out all the way to once a month, and they've been able to maintain their weight. So I think that that is going to be a little bit different for each person, and it'll have to be kind of customized for you. Okay, so let's talk about the compounded form of these medicines. So why do we have it, and how does that work? So why we do the compounded form of these medications at Harmony Aesthetics is because there are a lot of people that cannot get the brand name Ozempic, Trulicity, Wegovy. So let me talk about that. If you are diabetic, we almost always can get one of these medications approved for you. If you are pre-diabetic and you have commercial insurance and not a government insurance, not Medicare, Medicaid, TRICARE, anything government related, we have about a 25% chance that we can get Ozempic or Trulicity covered under your insurance for your prediabetes or insulin resistance or metabolic syndrome or something that is related to what you actually have. The rest of everyone, at this moment, we cannot get one of these medications approved typically. Now, Wegovy has a website where you can go, you can put your information, it pulls up your insurance information and tells you if you would qualify for Wegovy under your insurance. If you do, there is a $0 copay card that lasts for a year. So that's awesome if you're that person. If you're none of those people, that is why we're actually offering the compound. So let's talk about compounding. How can this happen? Because these drugs are new. So these medications are made of peptides, and peptides exist everywhere. So that is not the branded, that is not the trademark part. The trademark part of these medications is actually the combination of how they're put together and the compound form of them. So the reason we can offer semaglutide and tirzepatide, the reason we can do that is because those compounds exist in the world already, and they are just compounded with different types of vitamins, B6, B12, so that they can be given to patients like that. I think it's important just to kind of understand, because you can't compound most medications that just came out, but that is actually what makes it different. Now, what's different about compounding? So these medications can be compounded at a very specific type of compounding pharmacy. They have to have a hood for doing these type of procedures. It's very regulated. What makes it different though is that no one is going into these pharmacies and checking every single batch to make sure that it has the exact same dosing of medication like the FDA can do with any of the drug companies. Now, all that being said, we've been using compounding forms of these medications since around May of 2022. We've had no issues whatsoever. The side effects are the same. The patients are losing the same amount of weight. So we use trusted compounding pharmacies that we've used for a long time. So the way that we're offering these medications is that you can come in for weekly injections. If it's for semaglutide, it's just a $75 once a week injection. We also give a vitamin complex injection at the same time. And more importantly, what makes it very different is that every time you come in, we do your body composition. And why do we do your body comp? Because I care about your muscle. One of the biggest side effects I've seen, the one I'm really concerned about and what I see in women, is if women cannot eat enough, they are not getting their protein and they are losing their muscle. And what happens with that? We're slowing metabolism down. So for those patients, I'm actually pulling back on their dose of medicine because I need them to stop losing their muscle. It doesn't stop them from losing weight, but it stops them from losing their muscle. So that's actually why we do the body composition every single week. And if you come in as a new patient, which you can walk in as a new patient to Harmony Aesthetics, one of the providers, myself or one of my nurse practitioners, will actually see you, go through your medical history, make sure that you actually qualify and answer any questions for you. The reason that we do it as a pay-as-you-go is because we don't know if you're going to tolerate the medicine or not. I'm not taking $1,000 from you, $1,500 from you, and then we don't know if you're going to even be able to take it. And so I found that a pay-as-you-go type of thing actually makes it easier for patients. And then another thing to know about it is on the tirzepatide, the way that that works is that it's $100 for the starting dose of the injection. And each time we go up on the dose per month, that's an extra $25. So it goes from 100 to 125 to 150. That peptide is a much more expensive medication for us to get. We actually are getting it this week for the first time. We had to really look around for it and make sure that we were getting it from a reputable place. Okay, so that's all of the information that I have, although there's still lots of little caveats. That should give you 99% of the information that you need to make a decision if it's the right medicine for you, and what the contraindications are and what the side effects are and who can take it and who shouldn't. If you have any questions, just let us know. You can either call us at Harmony Aesthetics. Again, you can just walk in. We're open Monday through Friday. Just walk in and we'll answer questions for you. I hope it helps. And like I said, sorry for how it looked, and I'm exhausted. And this is long, but I wanted to get it out to you tonight because this is super important, because everyone keeps asking. Y'all take care and have a good night.